Alberta, Canada. A political storm is engulfing Alberta's healthcare system. At the center of the controversy is Health Minister Adriana LaGrange. LaGrange is facing mounting pressure to resign. Allegations of corruption and interference in health contracts have plagued her tenure. Critics are demanding answers. They want accountability. The scandal has shaken public trust in the Alberta government. It has also raised serious concerns about the integrity of the province's healthcare system. At the heart of the matter are allegations of preferential treatment. Critics claim LaGrange favored certain private companies. They allege these companies received lucrative contracts. These contracts were awarded despite concerns about cost and transparency. The controversy has deepened with the involvement of key figures in the government. Former AHS CEO Athana Mentzelopoulos has come forward with explosive allegations. She claims she was pressured to approve questionable deals. These deals involve LaGrange, top civil servant Andre Tremblay, and even the Premier's office. With each passing day, the scandal seems to widen. It threatens to engulf more officials. The situation remains fluid. However, one thing is certain: the Alberta health scandal is far from over. The fallout could have significant implications for the province's healthcare system and the political landscape for years to come. Central to the allegations against LaGrange are contracts awarded to private surgery clinics. These contracts, critics argue, were awarded without due process. They also allege the contracts were financially irresponsible. One contract in particular has drawn significant scrutiny: the deal with MHCare Medical. MHCare Medical, led by Sam Maraish, secured a $70 million contract. The contract was for children's pain medication. However, controversy erupted when MHCare only delivered 30% of the promised medication. To make matters worse, the medication was later deemed unsafe. Adding fuel to the fire, several cabinet ministers, including Infrastructure Minister Peter Guthrie, were found to have accepted luxury box tickets to Edmonton Oilers games from MHCare CEO Sam Maraish. This revelation raised serious concerns about potential conflicts of interest and whether those in power were prioritizing personal gain over the public good. The optics of these dealings are undeniably damaging. The public is demanding answers. They want to know why these contracts were awarded. They also want to know if their elected officials were compromised in any way. The growing scandal has eroded public trust. It has cast a long shadow over the Alberta government's handling of healthcare. The situation took a dramatic turn when Athana Mentzelopoulos, former CEO of Alberta Health Services, AHS, filed a wrongful dismissal lawsuit. Mentzelopoulos alleges she was fired for investigating the questionable deals involving LaGrange, Tremblay, and the Premier's office. Her lawsuit sent shockwaves through the province. In her lawsuit, Mentzelopoulos claims she was pressured to approve the MHCare contract despite her concerns about the company's ability to deliver. She alleges that her refusal to comply with these demands ultimately led to her dismissal. This suggests a potential cover-up. It raises questions about what lengths those in power were willing to go to silence dissent and protect their interests. Making the situation even more suspicious, the entire AHS board was dismissed just 3 weeks after Mentzelopoulos' firing. Andre Tremblay, a central figure in the scandal, was then appointed as CEO. This move has further fueled speculation about a potential cover-up and raised concerns about the independence of the AHS. The Alberta health scandal has divided the province. Premier Danielle Smith continues to stand by LaGrange, expressing confidence in her ability to reform the health system. Smith has also announced an independent investigation by an outside firm. However, critics argue that this investigation lacks credibility. They demand a full, independent judicial inquiry. The opposition, led by former Calgary Mayor Naheed Nenshi, has called for LaGrange's immediate resignation. Nenshi has labeled the situation as potentially the worst scandal in Alberta's history. Public outrage continues to grow. Protests have erupted across the province. The Alberta health scandal is a complex and evolving situation. It has exposed potential corruption within the government. The allegations, if true, represent a betrayal of public trust. The scandal has also highlighted the urgent need for greater transparency and accountability in government. The outcome of this scandal remains uncertain. However, one thing is clear: the consequences will be far-reaching. The scandal has the potential to reshape the political landscape of Alberta. It will undoubtedly have a lasting impact on the province's healthcare system. The people of Alberta deserve answers. They demand accountability from their elected officials.